picking up where we left off, we're covering from the humerus to the elbow. And looking here, the muscles are less, which is great. So we'll cover up top the chromium process with the clavicle and the coronoid process sticking up. We have the clavicle. Looking here, this is your biceps brachii muscle. There's the short head and the long head. So the short head comes across and attaches to the coracoid, whereas the long head comes up through the intertrabecular groove and attaches up top. So when we look in between the greater and lesser tubercle, that's your long head of your biceps brachii. And then coming down, you can see here we've got where it attaches, so the radial tuberosity coming down. So coming across here, it's your chromium, your clavicle, your coracoid. This right here is your brachialis muscle. Say that 10 times fast. Here's your humerus. There's your lesser tubercle, your greater tubercle. This is your humeral head here. This is your brachialis muscle. So you have your biceps brachii and then your brachialis. So don't get those two confused. That happens quite a bit. And your brachialis attaches down on your ulnar tuberosity. So, kind of getting the lay of the land here, you have your biceps brachii muscle, your cephalic vein, and that's that vein that all of you guys can see, and you're trying to go into it, and I wouldn't let you. Really superficial and very fragile. So, this is your deltoid, so you know we're up pretty high. And then your triceps, there's 3 of them, so tricept. So we don't distinguish between the 3 different areas. We just call it the tricept, okay? We have the brachial artery with your basilic vein. So the basilic vein is usually where we're going in for a PICC line. Looking here, we have your biceps brachii, by 2 brachii. So we just call it the biceps brachii. We don't differentiate between the 2. They're hard to see the difference. You have your brachialis muscle coming around. This is your humerus. This is your radial nerve there. And coming down, this is your tricep back in here. And you have your ulnar nerve there. You can see your brachial artery and your basilic vein. As you can see, they're very close together. So I actually went into the basilic vein, went through it, and hit the brachial artery, putting in a PICC line once. Never do that again. So you have your biceps brachii, and you can see your cephalic vein. It's getting smaller there. And this is your brachialis and your brachioradialis. So you have your brachialis, your brachioradialis, and then you have your radial nerve here, and then your triceps posterior. This is your humerus. As you can see, we're pretty low, so we're going into the elbow here. And you have your brachial artery, and that's your basilic there. So looking up top, here's your bicep tendon. This is your long head, okay, your deltoid. So this right here is your inferior glenohumeral ligament with your infraspinatus muscle. So there's a tear in the labrum here, and you can see that there's contrast. This is a contrast study. So here's MRI, T1 axial. So we have the cephalic vein, your biceps brachii, your brachial artery with your basilic vein. So big vein right there. Here's your tricep muscle, your brachialis, humerus, and your triceps. So as you can see, it's hard to see the difference between the muscles. It gets tricky sometimes. So your cephalic vein, your brachial artery, look how superficial that is. So you got to be careful that you don't hit that. Here's your biceps muscle and your brachialis muscle down lower. So I want you to know your ulnar nerve runs right along there, and this is your tricep muscle and the tendon where it's attaching. This is your distal fat pad. So you have a fat pad back there, and we always look for the distal and anterior fat pad to see if there's any kind of sign. It's called the fat pad sign. If there's a positive fat pad sign, means that there's a fracture in the elbow that we can't see. So here's your distal humerus, your extensor carpi radialis longus muscle, and your brachioradialis muscle. So your radial nerve runs right in there. This should look familiar. So we got the rib, and we have the intercostal muscle with your serratus muscle right there. Here's your subscapularis muscle. Here's your scapula, your teres minor, your latissimus dorsi. That's hard to see. Your teres major. You have your tricep coming down, and we have the deltoid with your humerus and your biceps brachii muscle. Coming up front, we have your pectoralis major, and you can see the line right there. This is the differentiation between your pectoralis minor and major muscle. So, biceps brachii. Up top, you have, let's see what I want, the basilic vein, your brachialis muscle. This is your trapezius in the trapezius, your triceps in the back, your profunda brachial artery with your radial nerve, and your cephalic vein. So I want you to know median cuboidal vein, you got your bicep muscle, and I want you to know your basilic vein and extensor carpi radialis muscle. You've got your ulnar nerve runs right in there. Here's your tricep muscle coming down to attach, and your extensor carpi radialis longus muscle. So here's your cephalic vein. Looking at the shoulder again, we're heading down low though, so we'll review it. This is a sagittal T1. You have your supraspinatus tendon coming across there. Here's your acromion. Your infraspinatus muscle is here with your teres minor, and coming down, this is your brachial plexus. Here's your teres major, and we're looking at the latissimus dorsi muscle here with the coracobrachialis muscles right there with your bicep muscle, and here's your deltoid and your biceps tendon coming around here. So on this side, we have your supraspinatus tendon coming across with your deltoid here in the back, infraspinatus muscle, your teres minor, and coming down here's your tricep muscle. So, and then we have your brachialis with your bicep. So this is anterior, and your deltoid. Looking at your triceps on where they attach, so one attaches to the scapula and one to the back of the humerus, and they attach down on the olecranon process of the ulna. So looking here, this is your lateral epicondyle, your capitulum. You have your radial humeral articulation with your radial head, radial tuberosity, and then you have your radial notch right in here. This is your coronoid and your ulnar humeral articulation right here, your trochlea, and your medial epicondyle with your olecranon fossa. So head of the radius, neck of the radius, here's your radius. Coming down, you have your styloid process on the lateral side, and you have, so Lister's tubercle there, so the styloid process of your ulna. You have your ulnar notch and your ulna coming up. So in between, there's a meshing, it's called the interosseous membrane, so it keeps the bones together also. So you have your ulnar notch, head of the ulna, styloid process, distal radial ulnar joint. You have your carpal articulation with your styloid process of your radius coming up your radius. You have your radial tuberosity. You have the neck, the head with your radial notch. And olecranon process up top, the trochlear notch, the coronoid process, and your ulnar tubercle and proximal ulnar, radial ulnar joint. So the humerus coming down, your medial epicondyle, your semilunar notch right in here, your coronoid process, and your ulna with your radius, your interosseous membranes right there, the radial tuberosity, ulnar tuberosity, your radial head, trochlea, capitulum, and coronoid fossa. So hopefully all this is good review for you. You have an olecranon process, the trochlear notch, the coronoid process with the radial head. So looking down at the other end, we have the head of the ulna with the styloid process, the articulation for the lunate, articulation for the scaphoid, and you have your styloid process and your ulnar notch of the radius. So here is a coronal, well, yep, we'll start here. Here is, I'm sorry, a sagittal T1 of the elbow. So coming down is your humerus. This is your triceps. And your tendon of your triceps muscle is your olecranon. your trochlear notch, your biceps tendon right there, and your brachioradialis. This is actually still the muscle. Here's your ulna, coronoid process, your trochlea, and your brachialis right there. Coming back here, this is your triceps and your corneus muscle with your radial head. What is saying this one is? Oh, your supinator. Here's your radial head and your brachioradialis muscle. This is your capitulum and your brachialis, sorry, and your biceps right there. So you've got your biceps and your brachialis. This is CT, so we have the olecranon fossa of the humerus, lateral epicondyle, medial epicondyle. Here is a diagram, so you can see your brachialis muscle, and you see your joint capsule with your anterior fat pad. Here's your trochlea, your synovial membrane. Normally we can't see that. So the coronoid of your ulna, here's subcutaneous fat, and we have the olecranon bursa. So the olecranon process is here, and I want you to know your posterior fat pad, that's where it's located. This is your triceps with the fat again. Humerus, this is how it's all held together. So your radius and your ulna, you have your annular ligament, and you'll see that wrap around the radial head and the articular capsule, and then these are the collateral ligaments here. So tricep, this is kind of a weird cut. It's not a true coronal. A true coronal would be going this way more. This is kind of a funky cut. So the tricep is actually lateral when it shouldn't be. So the main thing here is seeing the lateral collateral ligament here, and here's the medial collateral ligament. So here's your radial head, your supinator muscle, your extensor carpi radialis longus. We have your flexor digitorum, superficialis muscle, and you have your pronator teres muscle. So we're having fun. Okay, so your brachialis muscle is here. This is your brachioradialis. So you can see the radius, so brachioradialis. These little ones in the back, I'm not going to worry so much about yet. So here's the pronator teres muscle. And of course, here's your olecranon. Looking here, we have the pronator teres, the biceps brachii with the brachialis, and the brachioradialis that is over by the radius. The corneus muscle, here's your ulnar nerve right there. This is your medial epicondyle, your lateral epicondyle, and your olecranon. So looking here, we have the biceps brachii coming in. We have the brachialis and the brachioradialis. And then medial, we have the extensor carpi radialis longus, and the flexor carpi radialis muscle is there with the pronator teres muscle. So here's your humerus, your posterior fat pad. Here's your anterior fat pad. Looking at the triceps tendon, you can see how it's dark, so that's your tendon. Here's your olecranon process, your coronoid process, your ulna, your flexor digitorum profundus muscle, and your pronator teres muscle. So here is your brachialis coming down nice and fat across the elbow, and then your biceps muscle here, and your humerus, of course, down the middle. Excuse me, so your teres muscle is here. I want you to know your radial head, your extensor digitorum muscle, and you have your extensor carpi radialis brevis muscle, and your extensor carpi radialis longus with your brachioradialis. So that's a lot. We're going to stop there, and then we'll pick up for the forearm to fingers.